Hi, so today I'm going to go ahead and go over our amalgam setup. So on my amalgam setup, I do have two basic setups ready. I have one on the assistant side and one on the dentist side. Okay, remember the one on the assistant side is always going to stay as far away from the dentist as possible. These cotton forceps are only going to be used to take out any type of things that I need from inside of the drawer. In case I'm missing something, I can come into my drawer and go ahead and grab something without cross-contaminating. As well as on the assistant side, you are going to have the amalgamator, your amalgam capsules, your amalgam well, and your amalgam carrier. In the middle, I'm going to have my anesthetic setup ready, which is going to consist of a cotton tip applicator, gauze, cotton rolls, anesthetic syringe with your anesthetic carpule and anesthetic needle with your sheath, and your topical. Always remember to ask if there are any allergies. The last thing that we need is somebody to go into some type of anaphylactic shock due to lack of us asking if they have any type of allergies. I also do have my x-rays ready for doctor to view. On our setup for the doctor and I to share are going to be an array of different instruments. So on my setup here, I do have it ready for a complex type of filling. And what makes it complex is that I will need to use my Toffemeyer and my matrix band and my die-cal. So I have my two different types, which are my catalyst and my base. I do have my die-cal instrument, and I do have my mixing pad. Along here, I do have the doctor's basic setup ready. And remember, that one is going to go into the patient's mouth. I cannot use any of that stuff to grab anything from the drawers. That is strictly into the patient's mouth. Also on the doctor's side, I have the doctor's burrs on the burr block. Every doctor is going to be different on the types of burrs that they like to use. So please get with your doctor prior to treatment to ask them what type of burrs that they would like to use. I also have my array of instruments. So starting from the left to the right, I have my spoon excavator. I have my condenser. I have my Woodson. I have my acorn. I also have my ball burnisher, my discoid cleoid, and my full ball burnisher. For doctor, I have the air water syringe tip placed. I also do have a slow speed handpiece and a high speed handpiece. Always remember to test out your handpieces prior to calling the doctor in. We do not want doctor to come in and handpieces do not work. That is costing time, and that is also costing money. So the more time that we take on trying different things while doctor's in the room, there's treatment that is being delayed. On the assistant side, we have our LVE, we have our air water syringe tip, and we have our HVE. So that is what we are needing for our amalgam setup.